Have you ever thought that your well-meaning health advice might actually be hurting more than it's helping? If you're a health educator, a writer, or a provider, you need to hear this. Hi, I'm Tamisha Campbell, founder of Enhance Black Women's Health, and I'm dedicated to advancing health equity and supporting underserved communities by helping healthcare professionals communicate with more empathy, accuracy, and inclusivity. And today we're going to dive into something important: how the way we talk about health can either help or harm the people we serve. And I'll share a bit about my personal journey and why inclusive health communication matters more now than ever, and simple ways you can start communicating more effectively and compassionately starting today. Now, let me be honest with you. When I first started health coaching years ago, I didn't fully understand the harm that I could have caused despite my good intentions. Sure, I knew what they tell you: eat better and move more. But what I didn't know at the time was how deeply someone's environment, their culture, and their lived experience impacts their health behaviors. If I hadn't stepped away from coaching to study health education and writing, I might have kept up promoting really biased advice and completely missing the real barriers people face. That's why inclusive health communication is so important. Now, what is inclusive health communication, you ask? It's sharing health information in a way that honors the cultural, social, and lived experience of the people you're speaking to. And it's not just a nice to have, it's essential for building trust, creating real change, and avoiding harm. Inclusive health communication does three essential things. Number one, it recognizes barriers instead of ignoring them. Telling someone to eat better or exercise more without recognizing access issues, cultural stigmas, or safety concerns completely misses the mark and can feel incredibly dismissive. Two, make your advice culturally relevant. If you're suggesting recipes, exercises, or routines, make sure they align with the foods, the traditions, and the lifestyles of the people you're trying to reach. Otherwise, you risk alienating them instead of empowering them. And three, actively listen without assuming. Don't assume that non-compliance means laziness or lack of motivation. More often than not, it really reflects real systemic challenges, and active listening is how you uncover and address them. So if you found this helpful, make sure you subscribe to the Enhance Black Women's Health YouTube channel for more conversations about health equity, inclusive communication, and practical ways to make a difference. You can also join the EBWH community newsletter to stay updated and get access to even more resources. Thanks so much for being a part of this movement toward better, more inclusive health communication, and I'll see you in the next video.